Welcome everybody to this webinar on the effect of positive and negative pressure on lymphatic system pumping. Thank you very much for joining us on your evenings. So this webinar, just to give you an idea of the format, is Professor James Moore Jr., our presenter this evening, will be delivering a presentation that'll be around about 30 minutes, give or take. And then we're going to have an interactive Q&A session at the end. So if you do have any questions, obviously jot them down and we'll get them answered at the end of that session. Just a little bit of housekeeping before we get started is this session is being recorded, so anybody who's just joined, if you can please mute and avoid any background noise during the recording. If you do have a video, it'd be great to see the faces of who's on, as you see a few familiar faces already. So if you do have a video, please share it if you'd like to. And I mentioned the questions before, there is a chat function in Zoom. If you do use that chat function, and then I'll be able to ask your questions to Professor Moore at the end of the presentation. So a quick introduction, my name's Dominic Smith, and I'm the Clinical Application Specialist at PhysiQuip, where at PhysiQuip we aim to bring some of the most innovative technologies in the medical sector from around the world to the UK. And through that, that's how we met Professor James Moore Jr. So we actually met through a mutual colleague, Mr. Paul Thurchelvam, who's a breast surgeon at the Imperial in London. And that was initially around bioimpedance spectroscopy, the system that we work with, SOZO. At the meeting, we discussed about Jimmy's research that he was doing around the effects of pressure on the lymphatic system, and that naturally led to the talk around the Lymphotouch device that we work with, and also the medical technologies that Jimmy and his group also work with as well and develop. And then following that meeting, Andy Thomas and myself walked away just kind of mind blown. We thought we have to put some education on with Professor Moore at some point to share some of the information that he's researched over the years. So with that being said, I'm going to hand over to Professor Moore. He'll introduce himself and go through the presentation now.
Thanks, Dominic. Good evening, good afternoon, good morning, everyone. It's a pleasure to have you here, and it's a great honor to be asked to speak to you. I'm really impressed with the work at PhysiQuip and all the knowledge that they bring to this important area. It's lymphatics is a really underappreciated, understudied area, and so, for example, I'm one of the few biomechanics people, few bioengineers in the world that even studies it. So it's great to have a company like PhysiQuip get so involved in education like that. So thank you for this, and thank you all for being here. So as Dominic mentioned, I'm James Moore. I'm in the Department of Bioengineering at Imperial College. I actually trained as a mechanical engineer, but I've been doing nothing but biomedical applications since I was a student. So earlier in my career, I worked on the cardiovascular system, which is one way that we pump fluids around the body, and the lymphatic system is another way that we pump fluids around the body. So I'll go into the basic anatomy and physiology in just a moment. As part of my research, one of the things I try and do is always learn from my research and listen to what it's telling me about how we can solve medical problems. So we certainly enjoy looking at the basic biomechanics of these systems and understanding how they function. That's really important. But I'm always sort of listening to those results, thinking about, all right, how can we solve medical problems? Such as lymphedema. And so that got me started very early in my career down the pathway of medical device entrepreneurship. So we've developed some devices, we've patented some of them, we started some businesses, and it's really been a fascinating part of my career that I'm now able to share through a master's program in medical device entrepreneurship that I run here at Imperial. So on the left, you see a list of research projects ongoing in my laboratory with regard to the lymphatic system. And the one at the top, pumping analysis, is the one you're going to hear most about today. Although you can see we get our fingers into a lot of different aspects of lymphatic function. Vaccine design down there is an interesting new project that we're taking on, because the lymphatic system is really the superhighway for the immune system. So if basically we're looking to design vaccines that do a better job of getting the information into the lymphatic system, and therefore enhancing immune response. But I'm not going to talk about that today. As all of these, in all of these research projects, we do some experiments, we do some computational modeling, and we really try and combine that knowledge base together, because if you only do experiments, you can only understand certain parts of the system. If you only do modeling, you can only understand some of what it's telling you. So I think the real search for knowledge and truth for us really comes from the combination of combining the experience and the modeling, and that's what you'll see today. And then, of course, out of that, as I mentioned earlier, we're always listening to the results of our research to try and understand how we can solve those problems with typically a better medical device. So, and the applications you see are lymphedema is what I'm going to focus on today. Obviously, cancer is a big topic for us because the lymphatic system is the root of spread for all the deadliest forms of cancer, and immunity, as I mentioned earlier. So, so it gives you a good idea of the spectrum of research happening in the lab. Now, in terms of the basics, anatomy, physiology, layout of the system, this is really what we get. So you got here, arteries take blood away from the heart. That passes through the capillaries. So these are tiny blood vessels on the order of 5 microns. So a single blood cell has trouble squeezing through a capillary. It's so small. And then that blood comes back through the veins into the heart here. Now at the capillary level, and I'll come back to this in more detail in a moment, there's a net leakage of fluid that gets gathered up by the lymphatic system. That fluid has to be cleaned inside the lymph nodes, and then that passes back into the blood system. So if that fluid doesn't keep recirculating through the lymphatics, then you end up with fluid balance problems. And that's what really lymphedema is a fluid imbalance problem. If you look at the raw numbers of the system, so your heart pumps about 5 liters per minute of blood, and does so at pressures ranging from 80 to 120 millimeters of mercury. And your aorta is about that big in diameter. So it's a pretty large vessel, pretty high pressures and high flow. The lymphatic system only pumps about 5 liters per day. So it's a low flow system. The pressures are much lower here, going down to subatmospheric pressures, as you can see. So it's a low pressure system. And the vessels are very small. So most of them are about the size of a human hair, but the thoracic duct's the largest vessel. It's about 2 or 3 millimeters in diameter, which would qualify as a small artery. So you can see the numbers involved in terms of flows and pressures and sizes is very different from blood flow. And I think that's one of the reasons it's been largely neglected. It's just harder to get at the system than it is the arteries and the veins. So, with that, we're going to focus a bit now on this transport of fluid out at the capillary level into the lymphatic system, because that's really sort of, if there's an imbalance in that transfer of fluid from the capillaries and then what the lymphatic system can manage to pump out, and then that's where you start to see conditions like edema forming. So let's focus on that a little bit. So we got blood coming in from the artery here, going through the capillaries and then out from the vein back to the heart. So the amount of fluid that leaks out of the capillaries depends on the driving pressure. In other words, the pressure difference between the inside of these vessels and the outside, or all this white space, this tissue fluid pressure here of all the tissue that surrounds these blood vessels and these lymphatic vessels. So the tissue pressure out here in the white is generally going to be lower than the blood pressure. So there's going to be net pushing of fluid out at the capillary level, and that fluid needs to flow eventually into the lymphatic system. So it comes in at these initial lymphatics, which are sometimes called lymphatic capillaries. And as you can see, these are sort of blind-ended tubes. They're essentially passive tubes. They have cells that line the insides of them, and these cells can come apart, they let fluid in, and then the cells can close back up. But they do that passively just by being attached to the tissues around them. Those vessels, lymphatic vessels, don't actually do any active pumping. The active pumping happens further downstream in the lymphatic vessels that I'm going to focus on for most of my talk. So these lymphatic vessels then have to do the job of sucking the fluid in through the initial lymphatics, because as I said earlier, they're just passive little vessels here. So one thing to keep in mind now is that I talked about the tissue pressure being the pressure inside all of this white space around these vessels. Well, that tissue pressure also affects the performance of the initial lymphatics and the performance of these pumping lymphatics that are further downstream. And that's really what I want to talk most about today, is how that external pressure, that pressure outside the lymphatic vessels, affects their performance. So a bit more basic information on the lymphatics and how they do their job. So this is one of those pumping lymphatics that I mentioned earlier. So this comes from a rat mesentery. So this would be in the stomach of a rat. There are a lot of lymphatic vessels there. You can take it, stretch it over a microscope stage, and you'll easily see a bunch of lymphatics. So this is a lymphatic vessel. You can see it squeezing. That's how it pushes fluid forward. And then these valves, you can see two valve leaflets here, and you see a 3D image of a lymphatic valve here on the right in green. So those valves shut when the fluid starts moving back in the wrong direction, right? So that's how the lymphatic system keeps fluid moving back towards your heart, is that it squeezes, that pushes things forward, and then those valves shut when the fluid tries to move back the other way. So essentially what you have with the lymphatic system can be illustrated in this simple little cartoon, that pumping really is the result of the combination of squeezing and these little check valves, or these valves that keep the fluid from moving backwards. So what the lymphatic system does is what all pumps do. They take fluid from a low pressure down here in this lower reservoir, and they move it against gravity to a higher reservoir pressure here, illustrated on the right in the red. And again, it does that by the combination of squeezing, and then the valves keep the fluid from moving back in the wrong direction. So this pressure difference between the inlet reservoir and the outlet reservoir is an important factor in determining how much flow you can move with whichever kind of pump it is. Now, we can actually take lymphatic vessels out of the body and cannulate them, or stick tiny tubes inside them, and actually imitate this experimentally. So we have a pressure reservoir on the left at a low pressure, and a pressure reservoir on the right at a high pressure. And we can hook these vessels up and watch how they pump. So, and then what I'm going to come back to later is the importance of the external pressure on that pumping. So I just wanted to illustrate that there. But again, we can imitate this experimentally. That's what you see in the movie here in the lower right-hand corner. So that's a lymphatic vessel that we've taken out of a rat mesentery. I'll remind you that these vessels are about 100 microns in diameter. That's about the diameter of a human hair. My hands shake too much to be able to do these experiments. My collaborators that are brilliant at doing these experiments, and they really do amazing work. So this is from Mike Davis's lab at the University of Missouri. So what you see here is we've got a pressure on the left in blue and a pressure on the right in red. And we're going to ramp up those pressures, and you're going to see that how the lymphatic pumping changes over time. So this gives us important information on how the diameter varies with the pressure. You can see two lymphatic valves here. There's one here and one here. They open and close in response to the pumping activity. So we can learn a lot about lymphatic pumping with this kind of experiment. And what it tells us is, while we know what the pressures are, we can measure the states of the valves, and we can measure the diameter. One problem with that experiment is we don't know what the flow rate is that's being generated. These flow rates are tiny, tiny flow rates in these little vessels here. So it's very hard to measure that. Now on the left is what the vessel looks like when it's still inside the body. And you can see these cells, these little spheres floating through the vessel. So it's contracting just like the one on the right in the movie. And so this vessel is transporting immune cells to a lymph node. And we can actually track those cells, figure out their velocity, track the diameter of this vessel here, and that tells us what the flow rate is. So we can measure the flow and the diameter in this vessel, but unfortunately we can't poke in and measure the flow. So now we've got kind of an experimental problem here. We can measure flow and diameter, but not pressure here. We can measure pressure and diameter here, but not flow. But at least with these two experiments, we can learn more about lymphatic system pumping, piece that together, and try and understand how the system performs. Now, in terms of trying to measure these things in humans, you cannot measure pressure, flow, or diameter in any human lymphatic vessel to any degree of accuracy that would be useful for understanding the physiology. So, and if you go, earlier in my career, as I mentioned earlier, I used to do cardiovascular research. We can measure blood pressure, we can measure blood flow. There are multiple ways of doing that. And we can measure blood vessel diameters pretty easily, multiple ways you can do that as well. So imagine, if how far along our research and our medical treatments for cardiovascular diseases, if we couldn't measure pressure flow or diameter in any of those. And I think that gives you some idea of the challenge that we have with the lymphatic system. So one of the ways that we can fill in the gaps of these information from, one experiment gives us pressure and diameter, the other one gives us diameter and flow, is to construct a mathematical model. So we take the information from each of those experiments and we build up a set of equations that describes that pumping. So I'll just walk you through this plot that's moving around here. So this is the contraction of the muscle cells inside the lymphatic vessel wall. So this is an active squeezing. So the squeezing force goes up and back down, and then it relaxes. So that causes the diameter to decrease as it squeezes, and then the diameter comes back to its resting diameter where it was before. That causes a transient increase in pressure, which drives the flow out of the lymphatic vessel. Now, this last plot down here is the flow rate coming into that vessel as it squeezes. And you can see that during this period that the upstream valve is shut. This is meant to show you the importance of suction. So remember that it pushes the fluid forward as the diameter goes down, but really the job of these lymphatic vessels is to open back up after they've squeezed. And that's what allows you to suck in fluid from those initial lymphatic vessels. It's hugely important and previously underappreciated a part of lymphatic function. And this is a pressure diameter plot over here. If you know anything about cardiac physiology, this is like a pressure volume loop. And you can see this would be very familiar to someone in cardiac physiology. So, so this mathematical model allows us then to know the pressure, the diameter, the flow rate, everything about lymphatic function. But in this example, we've only got 4 little lymphatic vessels that would cover the space of about ½ millimeter in terms of a lymphatic vessel going from, say, your wrist to your shoulder. So the mathematics are quite complex, and we're just now getting to the point where we can model, say, a whole arm's worth of lymphatics. Very challenging mathematics. Now, one thing I'll point out here is that the transmural pressure, or the difference between the internal pressure, which is about 5 centimeters of water here, and the external pressure, which is about 2, is 3 centimeters of water. So when the vessel contracts, there's a force equivalent to about 3 centimeters of water, which forces that vessel back open. And that's why it comes back to its relaxed diameter, and that's how it's able to suck in fluid when it relaxes. Now, if we change that situation and say if we compress or simulate the compression of the vessel from the outside, so say we lowered that internal pressure, and now we've got the vessel is completely collapsed, and you can see its diameter doesn't change over the cycle here, even though we're applying the same contractile force of the muscle cells. So the pressure blips a little bit, there's no flow. This is a failing pump. So what we've done then by compressing the outside of these lymphatic vessels is shut down their pumping completely. And unfortunately, we think this is happening with compression bandages as well. So compression bandages do help. I'll come back to that later. But this really sort of gives you an idea of the complex challenges of trying to keep fluid moving with the lymphatic system. So, so that again, the pumping fails under that negative transmural pressure when the pressure outside the vessel is greater than the pressure inside the vessel. Now we can vary that external pressure. This is a mathematical model. We can let it run all day, all night on the computer, and it'll spit out a bunch of results for us. There's no way we could do this many experiments with either type experiment that I showed you earlier. So that's another advantage of the mathematical models, is they allow you to explore a lot of the system behavior. So with increasing external pressure, you're compressing the vessel from the outside. So what happens is when it contracts, it's got nowhere to go. It's already at a very small diameter, and when it contracts, it can't generate any flow. Now, if you apply a slight vacuum on the outside of that vessel, then what happens is you've expanded the diameter when it's relaxed, and then when it contracts, it can go down to a very small diameter, and that's how you generate the most flow. And again, this is based on the mathematical modeling that I showed you in the previous slide. Now, if you pull on the outside of the vessel too hard with too much vacuum, then it has trouble contracting. So there's actually an optimum external pressure slightly on the vacuum side that allows these vessels to generate the most pumping. And that's really our target in terms of trying to enhance lymphatic pumping, enhancing the pumping of these sort of medium-sized lymphatic vessels that are going to be pulling the fluid out of the interstitium and out of the tissue and out of those initial lymphatic vessels and pushing it on towards the heart. So if we want to optimize that pumping, then what we need to do is apply a slight vacuum pressure, not too much, on the outside of these vessels. And that's what you can see in this slide here. So applying vacuum externally is not a new idea. I dug this picture off the internet yesterday. It's a picture of a bunch of iron lungs. So this was used to help patients of polio breathe back before we had a vaccine, and were able to pretty much eradicate that as a disease. So the iron lung goes back several decades. There's still, I think, one person living on an iron lung these days, but they're pretty much all gone now. Now there is an application similar to an iron lung to enhance lymphatic pumping, and you can see it here being applied to someone's legs. So there's a lab in Italy run by Professor Campisi. There are others that are involved in this kind of work, applying vacuum on the outside of someone's legs to enhance the pumping and help manage lymphedema. So, and the proposed mechanism that they have on their website, which you can see linked there in the bottom right of the picture, is that it aids in the filling of the initial lymphatics. So it pulls the initial lymphatics apart so that fluid can get in. They don't really mention anything about what benefits it might have on the pumping lymphatic vessels. So that's the sort of new angle I'm bringing to you today. They also propose that it encourages new vessel growth, and I certainly hope that's the case. Now, the other device, which you might be familiar with the Physiology people here, is the Lymphotouch, which applies, as you can see here, a local vacuum, and that's done by a therapist. And so the proposed mechanism is very similar. It aids in the initial filling of the initial lymphatics, and you can go to the website here and see this animated. But the idea is here's an initial lymphatic vessel, one of those blind-ended tubes. It just has these very thin cells lining the walls. And as the vacuum is applied, those cells get pulled apart and fluid is able to come in with the gaps here. But again, it needs to be pumped out and sucked out by those lymphatic vessels that I talked to you about earlier. So I think these are great tools, and I'm hoping that what we do can help understand better how these things work. So the way we've been trying to apply negative pressure on the outside of the arm is by putting the arm inside a tube. So you can see someone's arm here inside this tube. And what we do is we use this piston to apply a cycling vacuum on the outsides of the arms here, with the goal of ending up on the slight vacuum side of that pumping curve that I showed you earlier. So we're trying to transfer this external pressure into the arm. So we need to know about the mechanics of the arm. This is a cross section of what your arm looks like, the two arm bones here, the muscles that allow you to move your hand around. And we could do some computational modeling of the arm to see how that pressure is transmitted inward. And you can see the pressures vary a lot depending on how stiff the arm is and where you are within the arm. So with some of these vessels, we can apply a lot of vacuum, say around this red area here. The ones in the green would not be receiving a lot of pressure variation. So that's something we need to keep in mind. But then again, obviously what we're after here is to enhance this pumping process that I illustrated earlier. and move the fluid out. Now you might notice something here that looks like a bicycle in the lower right corner. That is indeed what that is. So we believe that there are somewhere between 200 and 300 million people with lymphedema worldwide. And we want this device to be available to everyone around the world who has lymphedema. Most of those 200 or 300 million people are in sub-Saharan Africa, India, and in places where healthcare is not so great. So we wanted to make a low-cost version of this device, and that's the motivation behind having the bicycling pumping here. So it doesn't take much. It's not much of a workout, but a nice workout to be able to apply the amount of vacuum necessary to enhance the pumping out of the arm. And then our goal is to take our modeling expertise, again, these computational models that you've seen illustrated today, and apply that and determine exactly what level of vacuum we need to apply at what frequency, the amplitude, everything. So we want to optimize, we want to use our modeling expertise and our flow model, our flow expertise to enhance the amount of pumping that we get out of the arm. So that's what we did. We took some healthy volunteers, so students, they're cheap and we can use them in the lab if we get permission. So we did that, and so in terms of water, measuring the amount of effect we've had, so the volume really didn't change, and this is measured by just dipping the arm in water. Not very accurate technique. We've developed an infrared camera. You can see some of the scans on the right here. Again, it doesn't look like much of a change. Statistically speaking, there was no change, although it looks like a small change in a small increase in volume. And then we also used, using a bioimpedance technique, used this to measure the amount of extracellular fluid inside the arm, and that did change actually. So the impedance going up means that the amount of extracellular fluid went down. So we were able apparently to increase some of the pumping out of the arm. Now these are, again, they're students, they're pretty young, their arms are fairly skinny. So I'm not surprised that we couldn't change anyone's arm volume, but that's the experiment. So it's at least very encouraging. And we're hoping to, within the next year or so, start trying this out on patients with lymphedema. So again, coming back to this fluid balance picture here, vacuum helps the pumping here. Vacuum helps the filling of the initial lymphatics, but remember that tissue pressure appears over here as well in terms of driving fluid out of the blood vessels. So we need to be careful about applying vacuum on the outside of someone's arms, because it might actually enhance more of the fluid coming out of the blood capillaries. So it's not an easy picture. And we hope we can learn more about it soon. So wrapping up, the lymphatics are a bit mysterious, long ignored in medicine. And there are not many technologies out there for diagnosis, much less treatment of lymphedema. So we're working on that. It is an incurable condition, and we need to do all we can. There does appear to be a potential benefit for pumping using cycling subatmospheric pressures, and testing is underway, but obviously it ain't simple. There are a lot of other ways that those pressures can affect blood vessels and lymphatic vessels. Now, research funding is hard to come by. Only about 10% of our research proposals get funded, and that's true across every university in the UK and most around the world. So I recently got funded to develop a lymph node implant. I'm not going to talk about it today, other than I'm really proud I got funded and it's worth celebrating. So this would go in at the time of cancer surgery to prevent the edema from happening, and we're excited about that. So with that, I'll close with acknowledgements of the people who really did the research, my students and my collaborators, and our funding sources. And in terms of conflicts of interest, I'm obviously an inventor on these devices that we talked about today, and we did get the bioimpedance device loaned to us from Imperial, and thanks to Dominic and the team at Physiology for helping to facilitate that. So with that, I'll be glad to take your questions. And again, I'm very honored to be with you today and tell you a little bit about our research. So thank you.
Well, thank you, Jimmy. I appreciate that. I mean, this is, I've seen some of that stuff before. It still amazes me, all that kind of stuff that you share. So as you mentioned, we've got a Q&A now. So there's the chat function of Zoom. So if you're on a PC, it's in the bottom the bottom area, you'll find a chat function to be able to type your questions in there and I'll get them answered. Any question is a good question, so please don't be shy. Jimmy knows his stuff inside and out, so please ask anything that you want to cover. Just from our perspective, I mean, congratulations on the funding for the lymph node implant. I'm actually interested. Can you tell us a bit about what it is?
Yeah, so the idea is, you know, when a cancer surgeon goes in and they pull out a lymph node, there were lymphatic vessels connecting to that lymph node. So if we can find a way to reconnect those lymphatic vessels, hopefully we can restore the flow pathways. So that's the object of the implant. So it goes in, it's about the same size as an implant, and it contains substances that encourage the lymphatic vessels to regrow together. Yeah, so we've got some early preclinical or animal results showing very encouraging results with that. So the grant is to develop it further and get it ready for clinical trials.
Nice. Sounds interesting. I mean, one of the questions I wanted to ask as well is, like, with the effect of sort of positive and negative pressure, I know with a lot of lymphedema patients and patients that have got lymphatic problems, there tends to be a correlation between obesity. Do you think that obesity has an effect on the lymphatic pumping and the different pressures internally? And do you think that then that could affect what treatments we could be looking at? You know, could our treatments of more positive pressure be creating more compression that limits the flow again? I mean, what's your thoughts on that?
Yeah, I mean, we know there's a lot of individual variation in the lymphatic system. So if you perform some rough measure of lymphatic pumping in your arm versus my arm, you'll likely get something very different. So we know there's a lot of individual variation, obviously different body shapes, different body sizes. And honestly, we don't know much, enough about the lymphatic system to say one way or the other. Yeah, you know, it's clear that there is a relationship between obesity and lymphedema development. And, you know, we want our technologies to be available for all patients who might be suffering from lymphedema. So it's something that I hope we can look at in the future for sure. But it's not something that we've done so far.
Great. So, I mean, I've got a question from Alison Bashford. Do you know of any vacuum-based machines that have been developed specifically for legs?
So there was the one I showed in the slide earlier. So I'll just go back to that quickly. Maybe. So this Hypomat system, I believe it's from a company in Finland. Is that right, Dom? Do you know?
I mean, I know Lymphotouch is from Finland, but I'm not.
Yeah. So that's it. Yeah, that's the only one I'm aware of. Most of the devices that go around the legs that you know are distributed for lymphedema are actually compress the vessels. So no, I'm not aware of anything besides this one.
Okay. So I'm not sure if you're familiar with this device. We've got Rosemary Gardner just asking about Hypomat Deposition. I don't know if you're familiar with that technology at all.
Sorry, say it again.
The Hypomat Deposition therapy. I don't know if you've ever come across that before.
No, I've not. I'd love to learn more about it. I mean,
I can send you some more information about it. Rosemary was asking, what do you think about the Hypomat Deposition therapy on lymphatics? Obviously, if you don't know what it is, then unfortunately,
sorry about that, Rosemary.
Can't comment. I would comment, obviously, but with my complex with Lymphotouch, I wouldn't want to suggest anything because I don't know the device inside and out. So, Rosemary, we'll have to come back to that one another time, but we'll have a look for sure.
I'll have a look. You can email me, track me down on the internet and email me, and I'll have a look.
Perfect.
I promise, Rosemary.
Andrew Hall has said, thank you very much for a very interesting presentation and fascinating subject matter. So I appreciate the feedback with that. He's asked, how effective is this when compared to one, manual lymphatic drainage or manual lymph drainage, and two, kinesiotaping applied to edema? Do you have any sort of knowledge how it compares?
So manual lymphatic drainage is mainly going to be sort of, you know, graded compression, trying to move the fluid out. So that's really sort of acting on the compression phase of the lymphatic pumping, trying to do that, you know, modulate that with touch. And I'm a believer in manual lymphatic drainage. I think it helps, and I encourage patients to do that, to pursue it. It's not really operating on the refilling after the vessel opens, as far as I know. Now with kinesiology taping, it's fascinating stuff. I've seen some really interesting results from that. We think that may be having an effect on the opening of the vessels after they contract, and it's a complex biomechanics problem, and I wish we knew more about it, but that's something we hope to get to someday. But it's certainly there's a whole book on it now. I bought the book because I was just fascinated by it. It's definitely worth looking into.
Great. I hope that answers your question, Andrew. Just a quick note to everybody, there's quite a lot of questions coming through, so I'm going to get through as many as I possibly can, but if there is any that we don't answer, we will try and get them answered for you after the case. I just wanted to put that in there. It's great that you're asking questions, so keep them coming where you can. So Alison just asked again, how do you know what pressures to set the vacuum at? I'm presuming sort of to increase those flow rates. And
yeah, so that's really the object of all the modeling at this point, is to figure out what pressure. So we know what pressure is going to be optimal in terms of the pressure just outside the lymphatic vessel, and that's about -2 or 3 centimeters of water. It's not much pressure at all on the vacuum side. I mean, if you go up in an airplane, you get much more vacuum applied to your body. So it's a very slight vacuum. That's what we need on the outside of the vessel. Now, between the outside of the vessel and the outside of the body is a bunch of tissue, and there's muscle, and there's fat and skin and all of that. So that was the object of those fancy color models that you saw, is to figure out how is that pressure on the outside transferred in to where it reaches the outside of the lymphatic vessel. So that gives us our best guess at how much vacuum we want to apply with our device, and that's what we applied in those experiments that I showed you on the students.
Cool. Well, so I mean, I suppose from that as well, it's like obviously everybody's so individual, so to have the option of being able to alter those pressures to find kind of that sweet spot for that individual.
Absolutely, yeah. I mean, the personalized medicine is the future for sure, and I believe that in this case as well.
Perfect. So we've got a question here from Ken. He says, do you know of any recent evidence to support accelerated tissue healing in an MSK environment? I might add on to this because I'm an MSK background as well. But do you know if there's any evidence in that?
No, I'm not aware of any. Yeah, maybe you can answer better.
Yeah, well, as soon as MSK comes, I mean, from my practice over the last sort of 7-8 years is when I was introduced to lymphatics, it completely changed the way I started to treat MSK injuries, because MSK injuries in the initial phases, subacute even to chronic, they will have some form of fluid inflammation and fluid that gets stagnant in the area. It's not necessarily a lymphedema, but you just have that swelling that sits, and being able to encourage that lymphatic flow and encourage the blood flow in the local area, it's sped up so many results, particularly when I get patients at the acute stage and like tendinopathies that are sort of chronic inflammatory response. Being able to stimulate lymphatic system, as well as obviously the other aspects of MSK, has completely changed what I do. So being exposed to the lymphedema world has honestly, it's just changed the way you think about these systems. In the MSK world, lymphatics is almost completely ignored. From my training, I think we covered it for about 2 minutes. So it's something that if you're MSK, definitely look into it more and have a look at what courses that are available as to how you can actually approach that. So anyway, that's my answer, Dylan.
I agree. I'll just add a little bit to it. It's the lymphatic system, as I mentioned earlier, is important for immune function. It's also important for inflammation. And so, yeah, anywhere that's inflamed in the body, there's going to be a lot of lymphatic pumping activity. It also has been described as the sewer system of the body. So if there's any sort of loose tissue floating around, I had a broken arm a few years ago, and part of the job of the lymphatics is to get rid of all that debris from injuries. So I'm sure it is important.
Perfect. So Sue Hansard is on. Hi, Sue. So she's asked, or is asking around our test results on healthy individuals, so no problems with lymph vessels themselves. However, in primary lymphedema patients, vessels may be underdeveloped, malformed, valveless. So it'd be interesting to see how the negative pressure impacts on these structures. I mean, do you have any plans to do that? Can I ask a pre-question? Because I know we've got some people that are lymphedema background who will know that condition. There's a few people that probably are not familiar with that. So can you just revise very quickly what lymphedema is and how it potentially can happen?
Yeah, so that imbalance of fluid being produced out of the blood vessels and being absorbed by the lymphatic system just can result in a swelling of a tissue. So that's a swelling of a tissue is generally called edema. But then when we figure out that it's to do something to do with lymphatic dysfunction, we call it lymphedema. So that's sort of where the terminology comes from. So primary lymphedema, thankfully, is quite rare. 1 in 100,000 births or something. It's fairly rare. It's terrible to see because you'll see children with huge legs and extremities, and yeah, it's absolutely horrible. But yeah, a lot of the primary lymphedema is because of failures to form the valves, those little bileaflet valves that keep the fluid moving in the right direction. So the lymphatic vessels themselves may be otherwise normal, or there might be, there are several different types of primary lymphedema. Unfortunately, I'm not sure that our device is going to be useful in cases when there are dysfunctional valves. So, I wish we could do more for those patients. We're certainly willing to try, but if it's a problem of valves not being there, then I don't think this principle is going to be useful for them.
I mean, do you think there will be scope down the line? Is that obviously once you have a better understanding of how pressures work on normal lymphatic system, that then you're going to expand onto sort of abnormal systems and see how the pressures?
Yeah, absolutely. And that's, again, another value of the computational modeling is that we can go into our computational model and just change the parameters that govern valve function and model some of the leaky valves, or, and see how, modulating pressures or modulating other aspects of the system might be useful in helping those patients.
Perfect. Just creating a bit more work for you there, but creating some more research.
Yeah, sure.
So Maeve McSweeney has joined us from Ireland. I know she's from Cork. So hi, Maeve. So she's asking, essentially, does negative pressure treatment encourage the initial lymph vessels to draw in more extracellular fluid, or does it encourage the collectors to draw down from the initial lymph vessels?
Yeah, so I do believe that it will help the filling of the initial lymphatic vessels. So as you'll see with the vacuum devices I mentioned earlier, the thought in terms of how they help is they pull those initial lymphatic vessels apart, or the cells that line the insides of the vessels apart, and allow fluid in. And I think that's a very likely benefit of those systems. The effect on the collecting lymphatics, the ones that actually do the pumping, is what I talked about today, so that it definitely helps those vessels open up after they've contracted, so they can pull in more fluid from the initial lymphatics, and then when they squeeze, they can push more fluid downstream. So it definitely helps that pumping. Yeah, that's really sort of what we're trying to do, for sure.
Perfect, thanks. I was wondering if you can comment on this as well. So Katie Byrne has said, do we need to be, well, it says, it sounds like great care needs to be taken when choosing compression garments and bandaging, and there is a risk of using products that are too strong and maybe even detrimental. What would you comment on beyond that? Could using too strong a compression be detrimental?
I believe
both ways, actually.
Sorry,
both ways. It can be detrimental using too much positive pressure and too much negative pressure.
I believe that when someone is assigned compression bandages, or when that's prescribed, they are taught to apply them with a certain tension, and not apply too much compression. So I think there is at least a feeling, if not evidence, amongst the physical therapists that applying too much compression is a bad thing. So that external pressure in generally that tissue pressure I mentioned earlier, if you can raise tissue pressure, you will decrease the amount of fluid that leaks out at the capillary level from the blood system. So I believe it does help limit the amount of fluid that can come out of blood vessels. And I think that's its primary benefit. Whether or not it helps squeeze any of the fluid out through the lymphatic vessels, maybe when you first put the bandages on, but not after not after, say, a few minutes, I wouldn't guess. But again, I think that's something that I wish we understood better.
Brilliant. Thanks. That's answered your question, or your statement, Katie, anyway. And Zrinka, I hope I'm pronouncing that right. Zrinka Mendas has, she said she had a breast cancer 2 years ago and removed lymph nodes. And she knows that she's got edema in her hand, but she started to take control of it by doing push-pull, free weight and body exercises in the gym. So she's asking, before we start using machines, would it be better to first look at the most cost-effective choices like exercise and self-management?
Yeah, absolutely. So exercise is one of the 4 pillars of complete decongestive therapy that's recommended for patients with edema. So one is skin care. So, the lymphatic system being important for immune function. If you have immune function, you can, if you have immune function problems due to lack of lymphatic pumping, you can really get some serious infections. And we see that a lot when patients with lymphedema, that they get cellulitis. It can be very dangerous. So skincare is one, exercise is another, manual lymphatic drainage is another, and then the compression bandages. So yeah, I'm a big believer in exercise for all sorts of reasons, and I think it's important for patients with edema to continue that as well, but certainly under the guidance of a physical therapist.
I add to that, I'm in absolute agreement that exercise has got many benefits, not just from a physical perspective, but an emotional, social, and everything else.
Absolutely, very important.
I will say that obviously with medical technology, I'm going to be a little bit biased on this, but as a clinician as well, and the medical technologies that are available, they're designed because they work, and in many ways they work. So if you've got any sort of issues that you need sorting, then some medical technologies can be a good thing. But primary, definitely exercise and movements to maintain. You should continue that the whole time. But there are things that are available that can help for sure. Aisha, hi. So in the presentation, Jimmy, you mentioned about compression bandaging and hosiery and how this affects the external pressure. With all that in mind, will varying the compression of a garment be advised to find out which is the most effective for individual patients?
Yeah, I certainly think there's room for improvement in that regard, in terms of not only understanding how to vary that compression for each patient, but I think first we need to understand how it affects the lymphatic pumping. And our models would predict that increased compression eliminates lymphatic pumping or greatly reduces it. But then there are other parts of it. It's a whole fluid balance system, and it all works together. And it's just the world doesn't know enough about lymphatics to be able to say exactly how much compression we should be applying with compression bandages. And I think what you see in the physical therapy world is just years of experience of feeling someone's arm and applying the bandage and figuring out how based on experience how much needs to be applied. But yeah, I think we need to know more about that, and so lobby with your government officials and your charities and get more funding for us. We'll be able to figure it out, I think.
Thanks, I answered your question, Aisha. Rosemary Gard just asked what is MSK. So if anybody knows what MSK is, musculoskeletal. So it's anything to do with bones, ligament, tendon, and muscles and that kind of thing. So I think there's a couple more questions that were pre-submitted beforehand. But I've got a couple of questions here as well. You said that the lymphatics operate at a subatmospheric pressures or subatmospheric pressures. Well, firstly, what do you mean by subatmospheric? Sorry, I'm being a little bit. And how is that possible, and why does that happen?
Yeah, so there's a basic fluid mechanics principle that I'll try and get across here. So basically, if you have I have fluid between my hands, so air is a fluid, right? So if I have a higher pressure on this side than I do on this side, then the fluid is going to move from the high pressure to the low pressure. It's just being pushed that way, right? So it's a difference in pressure that drives fluid from one position to another. All right, now, in order to breathe in, the pressure in my lungs needs to be lower than atmospheric pressure. So my rib cage expands, it drops the pressure in my lungs I pull in air, and that's how we all breathe, right? So our lungs are generally going to be at a pressure that's lower than atmospheric when we're breathing in, right? Our lungs also have blood vessels in them. They're also so there's also lymphatic vessels there. There's a balance of fluid, and the lymphatic vessels that drain fluid from the lungs therefore have to be at even lower pressure than atmospheric pressure or the breathing pressure in order to keep the fluid from accumulating in the lungs. So that's sort of the concept of subatmospheric pressure that I was talking about. So pressure lower than atmospheric pressure. So you got atmospheric pressure here. In order to breathe in, your lungs need to be at this pressure, and in order to drain fluid out of the lungs, the lymphatic vessels need to be at an even lower pressure. And the body is beautiful at doing this. So it creates somehow these subatmospheric pressures. We think that has to do with that lymphatic suction, or that pressure that can be the dip that's generated after the vessel contracts. So if you're a cook, or if you've seen someone cook a turkey, you've seen a turkey baster. So that's a rubber bulb with a tube on the end of it, and basically you squeeze the bulb and you suck up fluid through the tube. So when you use a turkey baster, it doesn't work because you squeeze it. It works because you let it go, right? And that's really an important concept for all I've been talking about today. Is it's easy to get muscles to squeeze, but it's actually hard to get them to get the tissues to relax and open back up afterwards. And that's the principle that we're after with our device. And that's the principle in operation in generating subatmospheric pressures. So if you, for example, the arms, even the lymphatic vessels just under the skin in the arms are also at subatmospheric pressure. So if you were able to get a tube into the lymphatic vessel just under the skin in your arms, it would suck in air. It's a fascinating system. I mean, the blood vessels, are under positive pressure all the time. Lymphatic vessels have these crazy pressure variations all over the map. So it's a really cool aspect of lymphatic function.
I mean, lymphatics it is fascinating. I mean, on that point, actually, why do you think it's not kind of taught more? Because I know we've got quite a few people on here that are lymphedema specialists and specialise in lymphatics who, forgive me if I'm speaking for a few people, I know from my perspective, I just accidentally fell into it and then became really, really interested in it. It's something that people tend to fall into, and then it's like you get bitten by the lymphatic bug, the lymphedema bug, and it kind of goes, oh, this is really interesting from a clinical perspective. But why do you think it's not taught as often, and why there are so many medical practitioners, doctors, surgeons, down to physical therapists, that don't know about this system, probably the detail that they should?
Yeah, it's a real shame. So, I think it starts out with the fact that these are tiny vessels. The largest lymphatic vessel, as I mentioned earlier, is about 2 or 3 millimeters in diameter. It's about like that, right? And your aorta is this big. So if you, and then, so the size of the vessels, there's the pressure, I think, also plays a role, because if you're a surgeon and you cut into a blood vessel, it'll squirt blood out. Sorry for the gory detail. It'll squirt blood into the air. It's under a lot of pressure. If you cut into a lymphatic vessel, you probably never know. It's such a low pressure vessel. They're small. They're pretty transparent, and they just have mainly water in them. So they're sort of obscure. And again, if you're a surgeon cutting into the body, you'll cut through a lot of lymphatic vessels and never even know it. So some patients get lymphedema from, just whatever surgery. I had a friend get a lymphedema in his leg from some unrelated surgery, and that's a real shame when that happens. But yeah, it's a relatively obscure system, because I think it's, small diameters, low pressure, low flow. But over the years, if you think about the way medical education has evolved, it's not really evolved to include more about lymphatics, even though we know they exist now. We know they're hugely important for the spread of cancer, for obesity, for cardiovascular disease, for the major causes of death around the world, really. but it, you know, like medical education is unfortunately relatively slow to evolve. So most medical doctors only get about half an hour of training on the lymphatic system. Dominic, you mentioned you got a few minutes of training on the lymphatic system, and unfortunately that's typical. So, you know, I think that's one of the great things about you hosting these events is, you know, now, you know, we've been talking about the lymphatics for almost an hour, and that's more than most clinicians get in their entire medical education about the lymphatics. So, so there you go. Everyone out there, you're all experts now.
All right, so we've got a couple more questions. I mean, one of the ones I wanted to ask actually, because with the medical technologies that you have going on, is where are you at with that that vacuum device that you have at the moment? Like, what's the developmental stage of that at the moment?
Yeah, so we've got those encouraging results from trying it out on students. The student of mine who was leading that project has graduated and gone on to a fabulous job in industry, probably making more money than I do, and he's so he's left the project. No one's picked it up yet, so we're hoping we can get another student to pick it up or get some funding to carry it further. So it's unfortunately a bit stalled right now, but yeah, our next step would be to try it out on a few more volunteers. I think refine the design of the process. I mean, every time you try out a piece of equipment on someone, you learn something about how that piece of equipment could be better. And so we know we want to update the design a little bit, improve the seal at the shoulder is one of the main things we need to do. And then, you know, hopefully get it out there where we can try it on some patients as soon as possible.
Great. I mean, Aisha just asked another question. When you're applying, I'm presuming what you mean here, Aisha, is the negative pressure. Is it a continuous negative pressure or is it pulsation that you're using?
Yeah, so we're applying pulsation. So we want it to be at about the same frequency as the natural contractions of the lymphatic vessels in the body. So based on all of our research, we know that they contract about every 2 or 3 seconds. So it's a bit slower than your heartbeat. And so we try and imitate that behavior with the piston and the bicycling and all of that we apply on the outside of the arm. So yeah, that's exactly what we try to do.
Great. I know we're coming to the end of this. If anybody's got any more questions, then obviously they can send an email to us at the end of the session. Otherwise, I'm going to wrap everything up there. I'd like to thank everybody for joining this evening and for your participation as well. Some really, really good questions. And it makes the quick Q&A go much, much better, and we have plenty of participation. Jimmy, thank you so much for joining us and sharing all your research. You've got a research paper, haven't you, what you just covered? Is that right? I think I've got that one.
Yeah. So we've got, it's mainly on sort of the opening up and the sucking in of the fluid, but yeah, it's actually publicly available. You can find it on a journal called Scientific Reports. You can visit my website and find it through that, or just email me. I'll be glad to send it out to you.
Well, I think I've got the one. I'll double check with Jimmy to make sure it's the one, the right one. But in the follow-up email from this, we're going to have a link to a Survey Monkey. It'll take literally a couple of minutes. So if people have been on, if you could just put some feedback in, that'd be great, please. And then any ideas on any follow-up sessions that we can do would be great, because as Jimmy said, there's very little in terms of the lymphatic research. So we want to bring more to you guys, to clinicians, that you can take some of the amazing research that Jimmy and other people are doing and transfer that into your clinical practice. Because if that gives better results from patients in the lymphedema world, the musculoskeletal world, that's what we want to do from that perspective as well at PhysiQuip. So, and I'll double check that paper, and in that email I'll attach that paper so people can have a look at it as well. But otherwise, keep up to date with our website. We might have some more webinars coming up that might be of interest. But if you're interested in any of the products that are available, so I know obviously we do the Lymphotouch device. If you're interested, then please feel free to get in touch and let us know. Otherwise, thank you all for joining. Have a wonderful evening, and we'll see you all soon.
Thank you, everybody.
Bye all.